Actually, in these days, there are so many scientific evidence-based research a lot online. And actually, this meditation practice, particularly the mindfulness meditation practice, can improve the diabetes patients. And why? When you meditate, what happened to you? You have the first autonomic nervous system in your brain, and that autonomic nervous system has the two main branches, sympathetic nervous system and parasympathetic nervous system. Normally, the autonomic nervous system is working itself, and you are just breathing, blood circulation, emotion, hungry. These are all they do all the work with autonomic nervous system. When you on the way working with the autonomic nervous system, when you are just facing fear and dread, and also worry and grieved and danger, risk, and then the sympathetic nervous system start working, then you get stressful. When the sympathetic nervous system works, you get stressful. And that stress produces adrenaline and cortisol, two hormones. And adrenaline actually increases heart rate and blood pressure, right? And adrenaline hormone increases heart rate and blood pressure. And that makes heart disease. That when you meditate, when you're mindful of breathing, for example, rhythm of breath, simply don't worry too much when I say meditation. You have to just switch your attention, just pay attention to your own breath, rhythm of breath. Focus on the rhythm of breath. As I teach people counting method to get more focused on the breath. Because when you follow the counting method of breathing, you really, really strongly and deeply focused on the breath. You count it. One pair of in-breath and out-breath, exhalation and inhalation, 1. 2 pair of in-breath and out-breath, exhalation and inhalation, 2. Like this, up to 5. And 5 to go back to the 1 and to 1 and come back to 6. And when you are in a 6 and go back to 1 and 7, go back to 1 and 8, go back to 1 and come back to 9, and go back to 1 and come back to 10. And this is called greater 1. This greater 1 lasts for 5 minutes. And that 5-minute meditation can start changing your brain. And then a heart rate variability. Your heart rate becomes regulated, and heart rate variability becomes increased. When your heart rate variability becomes increased, your heart health is really satisfactory. Because heart rate variability is deeply connected with your heart health. If your heart health is better, your heart rate variability becomes better and higher. When you see your heart rate variability in higher, it means you get a good heart health. And this can go with mindfulness meditation. When you pay attention to the breath, sympathetic nervous systems shut off, right? And then parasympathetic nervous systems opened, because sympathetic nervous system and parasympathetic nervous system are working in an alternative. When parasympathetic nervous system is working with meditation, because it has the function of parasympathetic nervous system is rest and digest. The function of a sympathetic nervous system is for stress and worry and fear and anxiety and depression and also danger. When you are in danger, the parasympathetic nervous system switch on and open, and then you start feeling stressed, and you feel stressful at the moment. And that stress produces two hormones, stress hormones, adrenaline and cortisol. Adrenaline increases heart rate and blood pressure. That makes your heart problem, and also blood pressure and hypertension, right? And when cortisol increases, blood glucose, right? When you're stressful most of the time, if you are experiencing chronic stress, you are always at the mood of fight or flight. That means you are always stressful. That stress always increases heart rate and blood pressure, and also blood glucose. That makes your like diabetes become worse and worse because of the stress. Because you don't know how to switch off the sympathetic nervous system. But when you just pay attention to your own breath, simply, you don't need to take any medicine. You don't need to take, but you don't need to pay anything for that medicine. You just switch on attention and just pay attention to your breath and follow the rhythm of breath. Regularly, naturally. Don't make it quick, don't make it short, don't make it fast, don't make it slow, don't make it rough, don't make it smooth. Let it be. Let it do itself. What you have to do is just observe your rhythm of breath. In and out, in and out. If you can follow it from the beginning to the end, much better. Because you focus on the entire set of rhythm of breath, in breath and out breath. And your mind is there. It doesn't go away. When your mind is there with such powerful attention, it regulates heart rate and blood pressure. At the same time, blood glucose. Then you feel better from your diabetes. You feel better from you feel better from your diabetes and your heart disease and hypertension. By this mindfulness meditation, mindful of your own breath. How amazing it is. I love it because it's really amazing healing and managing your stress and heart disease and blood pressure and blood glucose. Simply meditating quietly. Sit down on your seat and just pay attention to the breath. What makes me amazing? This teaching is taught 2,500 years ago in India, but it now spreads around the world. In my country, I'm based now here in Burma. I started teaching my people how to deal with, your diabetes, hypertension, and heart disease by practicing this mindfulness meditation, walking and sitting. Of course, there's a walking meditation. When you do walking meditation, similarly, you as you pay attention to your own breath, when you're walking meditation, you have to just pay attention to the touching point of the foot, your touching points of the steps when you are walking. And you don't need to do anything quick, anything slow, but you just follow natural step, natural step. And that also regulate your heart disease, blood pressure, hypertension, and blood glucose, diabetes. How amazing it is. How the Buddha's teaching 2,500 ago can be adjusted with the modern diseases, diabetes, blood pressure, and heart disease. That can be tested by the modern scientific research, right? I love it really. What you have to do is just to pay attention to your own simple breath. You don't need to do anything special, but switch on attention. Just follow your breath. It regulates your heart rate variability, blood pressure, diabetes, blood glucose. At the same time, it increases your mental health and mood. And stress is away, depression is away, fear is away, worry is away. When you do this meditation, by paying attention, by following attention to by following the rhythm of breath, simply. It makes me really amazing. It makes me really excited. I respect the Buddha a lot. I got it just pre-diabetes in my age of 58 now. Just pre-diabetes, immediately managed, and now it doesn't come back to me anymore by practicing this meditation. This is my experience, not from other ones, but my experience. This is the reason I try to share this technique with everyone. You don't need to become a Buddhist, but you need to just practice, that's all. Of course, if you are Buddhist, you can feel much better with your Buddhism. But even if you're not Buddhist, no matter, you can do it. And that will bring the same benefits to you when you practice it. Because it doesn't discriminate among people. I hope you got it. I hope you will do it 100%. Thank you for listening to my talk. May all of you be free from all kinds of diseases and be happy and healthy.